నేను స్నేహ తివారీ, స్పోర్ట్స్ ఫిజియోథెరపిస్ట్. సో ఇప్పుడు ఫిజియోథెరపిస్ట్ అంటే ఏంటి? ఫిజియోథెరపిస్ట్ అంటే ఒక స్పెషల్ బ్రాంచ్. సో వీ హ్యావ్ అ ఫిజియో, వీ హ్యావ్ ఎక్సర్సైజ్ థెరపీ, వీ హ్యావ్ ఎలక్ట్రోథెరపీ, ఇంకా చాలా టెక్నాలజీ వస్తుంది. ఒక గేట్ అనాలిసిస్ ఉంది, దెన్ రోబోటిక్స్, వీ హ్యావ్ డిఫరెంట్ థింగ్స్ ఇన్ ఫిజియోథెరపిస్ట్. సో ఫిజియోథెరపిస్ట్ వర్క్ ఏంటి? సో ఫిజియోథెరపీ వర్క్ is not only after the surgery. The physiotherapy work is also before the surgery. So if someone wants to go with the knee replacement, probably manaki surgery tarvata oka physio kavale, but surgery mundu kuda oka physio kavale meeku to help in muscle strengthening. So once your muscle strength and you go for the surgery, then after the surgery also you required physio. This is about the surgery. Then second physiotherapist meeku edo oka back pain undi or shoulder pain undi, so sometimes you don't need medicines. Not only sometimes, but in rare conditions. ఇప్పుడు కొంచెం మేజర్ ఇంజురీస్లోనే మీకు మెడిసిన్స్ కావాలి, బట్ మైనర్ ఇంజురీస్లో అ ఫిజియో క్యాన్ హ్యాండిల్ ఇన్ అ బెటర్ వే. సో అ ఫిజియో క్యాన్ డూ లాట్స్ ఆఫ్ థింగ్స్. మీ లైఫ్ స్టైల్ మోడిఫికేషన్, యువర్ గుడ్ గేట్ అనాలిసిస్. నౌ డేస్ న్యూ టెక్నాలజీ ఆఫ్ పోస్టర్ అనాలిసిస్ ఉంది, వేర్ వీ అనలైజ్ యువర్ పోస్టర్ అండ్ డూ యువర్ పోస్టర్ కరెక్షన్స్. సో ఫిజియోథెరపిస్ట్ ఇస్ నాట్ ఫర్ ద ఓల్డ్ పీపుల్ ఆల్సో. These days the physiotherapist for youngsters like me. So we work daily 9 to 8 hours, 10 hours sometimes. So we get lots of muscle spasm, we get back pains, neck pain, shoulder pains, and lots of driving these days. So we do a long drivings, so we will have a back pain. So you have to go near a physio, and these days the physio demands are more. It's not only for the injury, but we are looking forward for all your muscle things. So we have physio who take care your core activation, take care of your glute strengthening, for the back pain, for neck pain. We do different isometric activity, we do isotonic activity, and the physiotherapy ante chala field undi. Anlo women's health physiotherapy undi, where a physio deal with postpartum, postnatal care. Then manaki orthopedic physiotherapy undi, where after a bone fracture and all, the physio will help a patient to get back to the normal life. Then manaki sports physiotherapist unde. So the sports physiotherapist ante on field ground lo undi players ki chala help chestam. So what happened, a player ki ippudu injury aina tarvata it's very difficult a player to go back to the sports. So adi physio duty undi to help the players. So sometimes oka player surgery ki elte players ki 6 to 9 months aitadi sports to get back into the sports. So we will help a player to go in the proper way. So same like manaki geriatric physios unnaru, geriatric physios will help in the falls prevention. Chala old members ki, elder members 50, 60, 70 years lo falls preventions chestaru. So physio is one of the great branch these days. So there are many people who are actually taking physiotherapists, and it's a very good services. And it's same like a medical person who studies for 8 years, and we as a physios also we study for 8 years. We study 4.5 years bachelor's, then 2 years of masters, then 1 year any fellowships or different techniques. So as a physio, I know what is the best thing to a person who is suffering with the pain. So after a pain, it's very important that you go near the physio. So thank you, Andy.